That's the problem with Obamacare. The subsidies are so much. It's billions and billions of dollars is being wasted.
We have a broken health care system, which the Republicans are now trying to smash into little tiny bits.
We can fix this, but the fix is fixing Obamacare.
If you're on the ACA, your premium is going to literally double. If you have your own private health insurance policy, your premium is going to go up.
Healthcare and health insurance, some of the main issues in the government shutdown. Joining us tonight is David Cordani, Chairman and CEO of the Cigna Group. David, thanks for being here.
Thanks, Brett.
You know, this shutdown obviously is concerning a lot of people, not just the process up on Capitol Hill. How do you see it from your perch in health insurance?
I think broader for the American people prefer government to be open. The affordability issue in America is something that mostly all people agree to, and that's fundamentally based on two things. One, our population is getting a bit older, and our health status is eroding. Fully 60% of all Americans are dealing with at least one chronic illness and disease. And second, a lot of the new services that are coming online, in many cases positive, are very costly.
Let me read you this Washington Post editorial board, and it's titled, "The Shutdown Conversation No One Wants." The real problem is that the Affordable Care Act, or Obamacare, was never actually affordable. President Barack Obama's signature achievement allowed people to buy insurance on marketplaces with subsidies based on their income. The architects of the program assumed that risk pools would be bigger than they turned out to be. As a result, policies cost more than expected. To salvage the program, Democrats expanded subsidies to entice more people to buy plans. You find that fair in how it's described?
I think it's incomplete. It's a very complicated topic, but I think it's incomplete. So the exchange brought individual products back to Americans, in many cases, who didn't have access to an alternative. Either they didn't qualify for Medicaid or they didn't have an employer-sponsored solution, so they were seeking to fill a void. Recently, they've been expanded tremendously, and the programs are not designed for some of the people they're servicing. If you step back, two of the programs that are working more effectively in the United States on a relative basis are Medicare Advantage and many aspects of the U.S. employer system, where we're trying to work to improve health or lower health risks, work with physicians on paying for value, not just for volume, and drive additional innovations. So it's a very complicated topic, and if you're an American who can't afford it, it's a very painful topic.
Yeah, I mean, bottom line, it's about pricing, right? I mean, the KFF's predicted average annual premium payments, if these enhanced tax credits expire, it's a 114% increase. $888 in 2025, $1,904 if these tax credits expire. Here's what Senate Majority Leader Thune says about all of this.
The HCA tax credits are rife with fraud, waste, and abuse. They are subsidies to insurance companies, nothing more, nothing else. And there's no cap on income. I mean, you can make $500,000 now, $600,000 in some places, and be eligible for federal assistance under this program.
So what do you think about that?
Again, that's one slice of the topic. So the newer subsidies that are being discussed are subsidies that were expanded during the COVID era. And the best way to improve affordability is not to argue about subsidies. It's to improve the overall price of services. For example, the brand drugs that the president has put a spotlight on. The brand drugs make up 10% of the overall pharmaceutical volume in the United States, yet make up 88% of the spending.
So obviously, you know, there's no love lost with insurance companies. You've made a lot. Cigna Group ended 2024 with significant revenue growth, about up 27%, $247 billion. You've seen the reaction. How do we change this in the short term so that people don't feel this pain in the long term?
One, improving overall affordability. Second, expanding access to care. And a good example of that, Brett, is earlier this year we came forward with our commitment to better, our voluntary commitment to expand access and ease of service, expand supportive services, and further expand value or affordability for individuals. And I'm proud to say, well, that happened in early 2025. In June of 2025, the industry as a whole partnered with the federal government. You
know, you look at the polls, the recent polls, David, and you've got health care, the major problem for your family, it's now healthcare costs, 51%, and utility costs, 46%. If the most important issue facing the country, healthcare is up to 11%. So clearly, this is a major issue for America.
Brett, we agree 100%. So we have tens of thousands of colleagues that wake up every day trying to improve people's lives for the better. The best way to lower health costs is to avoid a health event from ever transpiring. So to reduce a risk that an individual will confront diabetes, to confront a coronary disease, to confront complexity. The second best way is, if you're dealing with a chronic condition, to get the best possible care and coordination around that. A lot of that is pharmaceutical care, and most often a generic drug is the best. And then if you're confronting a major medical challenge, which a small percentage of Americans do every year, but they're significant, it's getting to a center of excellence, and we work toward that each and every day. Stepping back, improving affordability is paramount.
Yeah, it's a scary time for a lot of people paying those bills, and government shutdowns obviously don't help broadly. But thank you for the time today.
Thank you, Brett.